Malaria control remains a leading health challenge in the Bukedi sub-region and Uganda as a whole. The burden has continued to hit hard on the country's health resources. Many government interventions against the disease have been put in place, including the distribution of mosquito nets and the indoor residue spraying, call it the IRS. However, the indoor residue spraying, which according to health officials is an effective strategy to control the malaria transmission, has faced many barriers from the locals. Community members in the Bukedi sub-region, especially in the districts of Kibuku and Budaka, are opposed to the program with claims that the chemicals used to spray cause impotence in men and that from the time of its inception, they have never seen any impact as malaria cases have kept on increasing. The IRS program, launched by the Ministry of Health against the female Anopheles mosquito, aims at reducing the high malaria burden in the region and the country at large. The exercise is covering Budaka, Kibuku, Butebo, among other districts in the Bukedi sub-region.
That program really, it has been quite after some time, but people have failed to realize exactly whether what they are spraying is real.
And there are people, even when they go to test, you realize you're positive. They give you medication. After some 2 days, again you go to test, you're positive. So we are not seeing the
Moses Musana, the LC3 chairperson for Kameruka sub-county in Budaka district, say that the sub-county is currently registering high cases of malaria, which has made people shun the program. He notes that health officials have adequately sensitized the communities on the impact of spraying.
Malaria is very rampant, and even I'm wondering why is it so? Because according to the program of IRS, it is now more than 3 years or 4 years when they are spraying around. The problem is still existing. I don't know what is bringing all this. When you go to the health center 3, records in 2012, 2015, the malaria was not too much like it is nowadays. So I'm wondering why is it going ahead every year.
Athawa Kombwezi, the Budaka County Member of Parliament, said the situation of malaria infections is not good, but the community members are adamant on the interventions aimed against controlling the spread of the disease.
People are dying in numbers. And when people die, they blame it on superstitions. This people brought the medicine, it is making our children urinate blood, it's making us children lose blood. But when you get malaria parasites, they attack the liver. And once the liver is attacked, it also goes on self-defense. It stops producing blood and white blood cells. What happens next? The kidney cannot do the work of filtering. The capillaries break in the kidneys. That's why you keep on urinating blood. I'm not saying this as a medic, but it's common knowledge. But the problem with our people here is that, one, they are very stupid. Two, they are so dirty. Hygiene is very poor.
He said, as leaders, they maintain that the spraying must continue and whoever goes against the program will be arrested, especially local leaders who have misled the people.
Is that because our people are too dirty, people don't want to bathe, people urinate on their beds, the house is so stuffy, the mosquito knows where to go. Smelly armpits, the mosquito just goes straight because when it reaches your house, it has already known the target. It will not go on the wall. So you end up saying we are suffering from malaria and the insecticides are not working. That's not the case.
Dr. Rogers Natulinda, the National Coordinator for Indoor Residue Spraying at the Ministry of Health, said the launch of the spraying in the Bukedi sub-region is aimed at having people healthy and to eradicate malaria.
Because currently we are actually having epidemics in these districts. Okay? So we are targeting 8 districts for this spraying. Last year, November, December, we sprayed about 13 of them in the other region. Now here we are spraying 8. I don't have figures of the exact population, I'll look at that, but it's approximately 3 million in the 8 districts.
He said that the key messages to the program is to have people live in a clean environment.
So, the thinking is this epidemic, which actually has caused dire effects, has actually caused serious complications. We have children who are urinating blood, passing blood in urine.
Uganda has one of the highest global burden of malaria cases, with over 90% of the population at risk. Malaria remains Uganda's leading cause of death, especially in children. The disease causes immense detrimental health effects and is responsible for 30 to 50% of outpatient visits and 15 to 20% of hospital admissions. In 2021, the World Health Organization reported that there were an estimated of 13 million malaria cases and over 19,600 estimated deaths in the country. Majuma Bumba for City Post TV.